Hello everyone. In this video, we're going to be taking a look at an article from the Wall Street Journal. Now, this was published and updated on January 8th. It's written by Laura Landro. And before I get into this, let me just do the title here, because I know what I'm about to say is going to take a minute here, and it's just better to say the title first because it goes to what I'm saying. The psychiatrist can see your child now virtually. With a growing shortage of mental health professionals for children and adolescents, more healthcare providers are turning to technology. So basically what the Wall Street Journal is trying to push here, light on facts and heavy on the feels, is basically I don't want to say doctor approved, but some doctor approved version of BetterHelp. I shit you not on this. The same scam fucking shit that BetterHelp is what they're trying to push here. And they're going, oh, it's good for the feels. You know, like on the feels side, they're like, oh, look, it's so good. Look at your feels. Look at these couple of cases that we're showing you that it shows that it's a positive thing. It's fucking BetterHelp. But it's Dr. fucking Hawked BetterHelp. And they're doing it with kids. That's what's even more fucked up. Actual psychotherapy involves physically having the person there in front of you, because part of the job of being a psychotherapist or a psychoanalyst, a psychologist, a psychiatrist, whatever, is to read the person, to read their body language, to be observant of the environment when it comes to your patient. If you do this teleconference bullshit, BetterHelp crap, you don't have any of that. And this is not going to be positive in the long run for the overwhelming majority of young adults, you know, young teens, children, adolescents, so on and so forth. Because another thing is, how can you accurately diagnose someone without physically having them there in front of you of having a mental illness or some other, you know, defect or disease or something like that? You can't accurately do that. So what you'd end up having is just them pumping drugs out to kids. Oh, God. When Sarah Ford, 14 years old, was struggling with depression, hallucinations, and suicidal thoughts last spring, her pediatrician in Springfield, Missouri, was able to call in help from afar. So see, right off the bat, this is why I'm covering this article. It's right off the bat, they're laying on your emotion, you know, they're laying on the feels, they're playing with your emotions. They want you to feel bad for this girl so that you think that this is a good thing. For overall, through a live video conference link with Mercury Virtual, a telemedicine center 3 hours away, a child psychiatry expert evaluated Sarah, prescribed a medication, and set follow-up appointments. Okay, and he billed the insurance, didn't have to physically see someone. And how the hell can you prescribe a medication or an actual physical fucking doctor, like a doctor, you know, deals with your physical ailments? They will not prescribe you a medication without physically seeing you. Yet, a shrink can prescribe mind-altering drugs without seeing you, without physically seeing you, without physically evaluating you. And somehow, that's perfectly fine. I mean, this is what really gets me about this. This doctor has no fucking clue about this girl because he talked to her on Skype. He didn't physically have her in front of him. Did not get to read her body language. Did not get to look at the situation as a whole. And he just prescribes her fucking drugs. He should have his license fucking revoked for that shit. How is this remotely legal? With a rising number of teens and adolescents suffering from depression and anxiety, and too few professionals to help, remote video consults are helping pediatricians fill the gap in some communities. Excuse me, but why not look at the overall reason why there's more teens, a rising number of them, suffering from depression and anxiety? Maybe it's technology overload. So what do? You throw more technology at the fucking problem. Maybe it's, other aspects like that. I mean, because our lives become so revolved around technology, let's revolve them a little bit more. Instead of taking the kid away from the technology and physically talking to them and evaluating them, okay, and having because one reason why, like, for example, I mean, not exact, just like with the idea of say, shrinks and their patients, okay? One reason why shrinks are not supposed to sleep with their patients is because it's an intimate experience, because you are bearing your soul to a shrink. How can you bare your soul to a fucking webcam and a goddamn monitor screen? It doesn't work like that when you're dealing with mental health. God. I just don't understand this. This is... They're like, oh, well, they're helping people in some communities. In the long run, you're going to see more damage from this than you are going to see help from it, I'm sure. Because you're going to have misdiagnosis, you're going to have kids getting put on drugs they shouldn't be put on, things like that. Because they didn't physically see the kid. I mean, this is BetterHelp on a larger fucking doctor-approved, somewhat doctor-approved scale here. In recent years, more health providers have been turning to telemedicine for adult mental health services, offering remote, real-time video and audio appointments with a psychiatrist or counselor for patients who don't have easy access to care. BetterHelp. Basically, fucking BetterHelp. This is BetterHelp. Everyone out on YouTube knows what the Phil DeFranco BetterHelp fucking bullshit. They weren't helping people. They were fucking taking their money and not helping them. That's what this is basically. They're not truly helping these people. Oh, you get to talk about your fifis, and I'm just going to prescribe you drugs and shit. That's not how psychotherapy works. Because they want to read the person. They want to physically look at the person, an actual true psychotherapist or a psychoanalyst. Get a feel for the person, which is funny because they wait towards the end of the article to throw that in, knowing, oh, well, people probably won't read that far. As they're hyping up how great this is. School systems, universities, and healthcare providers are now testing out such programs for children and teens. Bad idea. You're better off having them physically talk to a person, someone who can read their body language right there, because you only see so much of them on the camera screen, so you're not reading the whole body language. You're not able to see if say part of their depression, they're not using proper, they're not keeping up with proper hygiene. All right. Which, on that note, the only way you can tell is if they stank, if they have fucking stank on their ass. Can't exactly, we don't have smell-o-vision, type situation. We don't have smell webcams where you can smell shit. Chesterfield, Missouri-based Mercy is a large health system that includes hospitals, clinics, and physician practices. Mercy has trained nearly 250 of its pediatricians and family medicine specialists in neighboring states to diagnose the most common conditions such as ADHD, depression, anxiety, and oppositional defiant disorder. Oppositional defiant disorder. Basically, someone who doesn't suck dick, I'm assuming, is what oppositional and go, yes, sir, sir. Definitely, sir. Tell me how high to jump, sir. That must be oppositional defiant disorder from the sound of it. But I'm sorry, but pediatricians and quote-unquote family medicine specialists, which are general practitioners that handle kids and adults, they are not trained to diagnose ADHD, depression, anxiety, or oppositional defiant disorder in their specialization. To say, oh, we trained them. They didn't get the years of training to see those things. They got some quick fucking course. And then they kick them over to this fucking tele shit practice crap. And yeah. How the hell can a pediatrician who's a doctor that's supposed to deal with physical ailments qualified to deal with mental ailments, okay? See, psychiatrists, on the other hand, they actually have to go to actual medical school before they go to psychiatry going to psychiatry. So that means they have their rotation and shit like that. So they deal with actual medicine. I could see a psychiatrist on that note, doing actual medicine besides psychotherapy. But I don't see it the other way around. Because they had the actual medical training to be able to do doctoring, like doctoring. Doctors don't have psychoanalysis training or anything like that. Except for the basic shit that they had to go through, in getting their degrees. I don't see how that's remotely a good thing. Mercy's electronic medical record system has links to tools and algorithms to guide doctors through best practices for different conditions and medication prescribing decisions. Yeah, let's let psychiatry, non-psychiatric based doctors diagnose these things. Sounds real fucking smart to me. Oh, God. The virtual team, meanwhile, can access pediatric patients' charts and medical history via the same electronic record, so they don't miss anything important in making a diagnosis, says Kyle John, a Mercy pediatric psychiatrist who leads and helped create the program, known as V Mental Wellness Kids. Oh, God. This just scares the shit out of me on how this is going to fuck up children in the future. This is going to fuck up kids more than it's going to help them. Seriously. You're not providing actual care via webcam. You're not providing actual psychiatric help or psychological help. Some studies show that so-called telepsychiatry is as effective as care delivered in person and may even be superior to in-person sessions for children with such issues as attention deficit hyperactivity disorder. How the fuck? All right. This is supposed to be a link, but they don't even have. I love this. There's supposed to be a link there, and it's not even there. They must have improved bullshit or something. But I don't see how this is going to help a kid with ADHD. I mean, I was diagnosed with ADHD, and not having someone physically in front of me and just having a webcam in front of my face, I don't, I look at it this way. I don't see it as like, the way that they, supposedly I have it. But, I mean, yeah, I have a short attention span. I can get hyper. If you couldn't tell by my videos. But, if I had a webcam in front of my face, I would be like, yeah, fuck you. I'd be all over the place. I'd be looking all over the place. I wouldn't be focusing because I don't have a person physically in front of me. If you have someone who's physically in front of you, you're directly engaging with them. Your attention is more likely to be on them and what they are saying, as opposed to, someone's face on a screen and you looking into a fucking webcam. So I don't understand where the hell they're coming from with this one, because it's a documented fact that people with ADHD tend to do better dealing with someone one-on-one when it comes to their attention, like physically dealing with them. This makes absolutely no sense, what they're claiming here. Like I said, it's all feels over reels. Parents, teens, and family practitioners report high satisfaction with remote consults and appreciate their convenience and privacy. Okay. I don't know how private they really are, considering if you're, say, using Facebook video chat, everyone and their mother knows what the fuck you were talking about. I mean, this is such bullshit. Oh, well, because they feel that it's better. They have more satisfaction with it because they feel it's better. I mean, like I said, it's feelings over facts. Remote psychotherapy, behavioral training, and prescription drug therapy can be offered through doctors' offices, schools, correctional facilities, and homes. Yeah, the last thing I really want is kids going into schools and having their fucking, guidance counselor who's a wannabe fucking shrink say, yeah, you should probably see an actual fucking shrink, and have them doing it on school property without necessarily the parent knowing, because that would happen. And this idea that the behavioral training and prescription drug therapy can be done through doctors' offices. You'd have doctors' offices without anyone actually trained in dealing with these situations in regards to the psychotherapy, giving training. But they haven't been trained. This idea of prescription drug therapy. So you're going to have a doctor that doesn't have a clue about psychotherapy or anything like that, prescribing medicine for a doctor who hasn't physically seen someone. This just sounds more and more fucking sketchy. Like, seriously, sketchier and sketchier as we go here. And I've read this already once, and I thought the same exact thing. I'm like, well, sketchy, sketchier, even more sketchy, more sketchier. As I was reading through, that's how I was looking at it. Still, the virtual option isn't a catch-all solution. Telemedicine is great at bridging distances, but it doesn't make up for the shortage of child psychiatrists, Dr. John says. By working in a collaborative model with pediatricians who know their patients best, we can say, you do the groundwork, we'll review everything and help you when you get stuck. So basically what you're saying is we're going to have unqualified people diagnosing kids with psychiatric problems. This sounds like it'll go over real fucking well, like I said. For ongoing therapy needs, some specialists urge caution in the use of virtual sessions. Access to care in any shape or form is better than no access at all. Yet there are some real disadvantages, says Sarah Z. Lipman, a New York-based psychotherapist specializing in adolescent and young adult mental health. I think she's kind of, because she doesn't want to badmouth some of her colleagues, I think she's playing it down a little bit. Because on the idea of access to care in any shape or form is better than no access at all. Obviously, she's never seen BetterHelp. Because BetterHelp would make her eat those words. It seriously would. Old school therapy adheres to the belief that, which I love how she's saying old school. Because this isn't old school. This has been a consistent thing with therapy up until relatively recently. Old school therapy adheres to the belief that true human connection comes from face-to-face, in-person contact, and without that, many things such as tone of voice, body language, even something as simple as the chair in my office that a kid chooses to sit in, or if they came in that day smelling differently, can affect or adjust the treatment. Yeah, exactly. Once she has established a relationship with a patient, she may hold virtual sessions if, for example, they are away at school, because rapport building has already happened in person. Right, and you already have half a clue about the person. See, in that case, all right, I can give a little bit of a pass on this. All right, because you have more than rapport. You've physically summed up the person. You've read their body language. So even if you're not getting the full picture, say, you're getting shoulders up or whatever, you still can read what's going on. Because you've seen the whole body and you've seen how things work in unison. So you know that if, say, they've got like a certain thing that they do with their head when they're talking about certain things, like tilted a certain way or something, and there's another part of the body that goes with that, you still can read on that even though you're not seeing the other part of the body, because you've already physically had the person in front of you. You can't do that when you're talking digitally. As many as 1 in 5 children experience a mental health issue in a given year. I don't think the numbers are that high. I truly don't. But children must often wait months and travel long distance for an appointment with a specialist. According to the nonprofit group Mental Health America, 62% of children with major depression in the U.S. don't receive any treatment at all. I'm gonna say that might be a little, look at another one that's supposed to be a link. It's not a link. I'm thinking they're full of shit on that one. I don't think it's 62%. I honestly don't think it's that high. Small towns and rural areas are the most underserved, but there's a growing concern for youth in urban and suburban areas as well, according to the American Academy of Child and Adolescent Psychiatry. Yeah, well, they're trying to justify their existence. And what gets me is psychiatry is not a fucking science. It's bagging it, blatant ass guessing. Oh, God. State law regulating the delivery of medical care via video conferencing vary widely. Insurance coverage for so-called telepsychiatry also varies by state and by payer, and private insurers do not always reimburse telepsychiatry on par with in-person care. Well, of course not, because you're not physically going to the fucking doctor. I can understand why they wouldn't want to pay for it. Telepsychiatry is an amazing tool for treating a child at the right time, in the right manner, right where they are, says Ujwal Ramtekar, a child and adolescent psychiatrist at Nationwide Children's Hospital in Columbus, Ohio. Pediatricians may get relatively little training in mental health, Dr. Ramtekar says, and virtual programs allow them to collaborate closely with child psychiatrists. Oh, okay, so you're saying this is a good thing to have clueless fucking people diagnosing kids. Yeah, this is going to go over really fucking well in the long run, I'm sure. Jesus H. Christ. Oh, this is a good thing. No, it's not. In more complicated or emergency situations, the pediatrician can ask an expert to see the patient immediately using a secure video connection. For patients who require longer-term counseling, Mercy also helps families find behavioral therapists as close as possible to their homes and partner with school therapy programs. Yeah, but they still want those shekels coming in from the telepsychiatry conferences, don't they? Because that's their bread and butter. That's what they're in business to do. I mean, oh, my feet. This is all feel. So feel for these kids. This is a way to solve their problems. Doctors diagnosing them without physically seeing them and prescribing mind-altering drugs. Yeah, this sounds really fucking positive for children these days. This sounds like something I'll go over really good with them on the note of where it's going to lead them in their future. It's going to fuck them over. Sarah Ford first confided her feelings to her mother, Susan Ford, who immediately made an appointment with Sarah's pediatrician, Ashley Merrick. Dr. Merrick linked Sarah by video to Cassandra Turner, a Mercy psychiatric nurse practitioner who evaluated her to rule out the need for hospitalization. The two then chatted for about 40 minutes to get at the root of Sarah's issue. Ooh, a whole 40 minutes. She evaluated her to rule out the need for hospitalization without physically examining her. Oh my fucking God. I just face palmed my forehead with that. If you heard it. She literally is trying to decide if this girl should be hospitalized or not, going by what she's watching on a fucking webcam. How is this remotely fucking legal? She chats for 40 minutes and then goes, oh, well, she's fine. Give me a fucking break. She doesn't need to be hospitalized. You don't know. Her father, let's get back to this. Her father had committed suicide in the home when she was 7 years old, and she had gotten afraid of the dark since then, and said she sometimes heard and saw things. To me, it sounds like she should be calling the ghost hunters, not this fucking shrink via Skype. Or she's not even a shrink. She's a nurse practitioner, a psychiatric nurse practitioner. So nurse practitioners, they can prescribe medication. So basically, she's a nurse that can prescribe medication for mental illness, from what it sounds like. To me, it sounds like she shouldn't be talking to this woman. She should be talking to fucking ghost hunters. She should get, what's his face? You know, with his big old fucking black, you know, like, glasses that you would have seen the guy from the agent from Stuck on You wearing. You know? I mean, shit. Sounds like she needs those guys as opposed to this fucking psychiatric nurse practitioner. She says she was hesitant to confide in friends. She often uses FaceTime on her iPhone and was comfortable with the idea of the video session with the nurse practitioner. After a few minutes, she was able to relax and talk to Miss Turner freely. Yeah, okay. A lot of kids are just going to lie out their fucking ass, and they're going to get away with it because they're not physically there for these people to read them. Miss Turner recommended a temporary medication for anxiety and insomnia and a genetic test to help identify the best antidepressant for Sarah, which was later prescribed along with a referral to a therapist. So wait a minute. Instead of actually physically working with the girl and trying to deal with her problems first and foremost, let's throw her on drugs. Therapist a second. Doesn't make any fucking sense either. That's another thing that I have an issue with this. Okay? Is that you have a situation where, let's throw them drugs first, and then we'll worry about the therapy after. Whereas you should be working on the therapy and see if the therapy actually is helping before you start prescribing mind-altering drugs that physically alter your brain chemistry. I mean, to me, that's how they used to do things with this. Now it's to the point of, we'll toss you some fucking drugs, then maybe we'll think about the therapy. It's literally this thing of, let's get them on pills. It's pills. All right. Oh, what the fuck? I mean, I remember where I mentioned my ADHD. I remember my shrink trying to fucking ply me with fucking pills left, right, and fucking center. I'm like, dude, when I got diagnosed, I was in college, okay? I'm like, I'm in my 20s, all right? And I'm going, I hate to break it to you, man, but yeah, I've been working my whole life with this as a thing going on. If I, because I look at it this way, I have a short attention span. I'm not going to classify it, but if you want to say it's ADHD, whatever, fine, I got it. But I'm like, so let's say I have this. I'm like, I've been, I was like 21 or 22 when I got diagnosed or something like that, somewhere around there. I'm like, dude, I'm in my early 20s. I've made it through my whole life. I made it through high school. I made it through college up to this point. But I had a really heavy course load when this happened and when I got diagnosed. And I was getting spread too thin, I think, more than anything. But yeah, he was trying to get me on, tricyclic antidepressants. He tried Ritalin. I'm like, dude, I'm not depressed. I'm not going to take anti-fucking depressants. I'm not going to alter my brain chemistry like that. Fuck off. He's like, oh, what about like, stimulants? I'm like, I already take caffeine and shit. Oh, here's some Ritalin. And I never fucking took it. It's like, okay, dude, fine, whatever. And I would just get the script from him, and I would never fill it. And I did fine. Because I understood, I understood how my mind works, and I worked with it. That's the idea of therapy, is to help someone figure out how their mind's working and to work with it. See, I figured that out on my own, though. That's the idea of therapy. So instead of actually doing that, that's like, we'll throw you some fucking drugs. Instead of actually working through the shit in the person's mind and working with it as well. Working through it and with it. Oh my God. Sarah says the hallucinations have stopped and she feels much better about life. If she's having fucking hallucinations, there's way more going on here. Holy fucking shit. I forgot about that. She's the one from the beginning. If she was having fucking hallucinations, you stupid fuck, she should be definitely seeing someone in person. Holy sweet Jesus. Oh my God. So she's on obviously something beyond what they're saying here. Because if you're having hallucinations, that's usually like schizophrenia and shit. So she's on more shit than they're talking about here. And they really obviously don't want to go in that direction because then they're just saying, oh yeah, this schizophrenic got diagnosed by someone via webcam. And she got lucky, which is exactly what happened here. She urges other teens with depression to speak up and ask for help. I'm just glad I told my mom and she was able to get help, she says. You're not truly getting help. Talking to someone via a webcam is not helping you in the long run. Sarah's mother, Susan Ford, says she is grateful that the virtual consult program was in place to help the pediatrician. I was able to get help and get it quickly instead of getting on a waiting list, she says. Well, you know what? You really didn't help your fucking daughter, you dumb bitch. She went in front of someone who talked to her for 40 minutes on a fucking webcam and tossed her a bunch of drugs and said therapy is secondary with how she did things. Because you go to therapy first to figure out what the problem is, to figure out the best way to treat the problem. You don't just start taking medication and then go to therapy. That's not how it used to work, because they understand, at least they used to understand, that these drugs are going to alter your brain chemistry. If you're going into a therapist when you're on these drugs, they don't have a baseline on you. They have no clue. Oh, God. I mean, this, as you can see, I mean, what gets me about this is how they're treating this with teens. These are the last people that should be using a system like this, because it's not going to benefit them in the long run. It's not. It's going to hurt them more than it's going to help them, because they're talking, when you have an article like this that's you doing feelings, and it's light on facts chat and not to the point of where it pretty much doesn't have any in it, that's not a good sign. Anyway, I've covered this well enough. I'm just going to leave things here.
If you liked this video, depending on where you are watching it, please give it an upvote or thumbs up. If you want to know when new content of mine hits the internet, don't forget to subscribe to one or more of my social media or video accounts listed here. Also, with YouTube, don't forget to ring that bell. You can find all of my video content on both BitChute and YouTube. This may not be the case with other places I upload to, but I will try to minimize this happening. You are always welcome to interact with me at any of these sites on the list, so feel free to do so. If you have anything you want me to cover in a video, when it comes to news or current events, send it right along to me. I will try to do my best to cover it. As always, thank you for watching.